Welcome to What's Trending, your go-to podcast for staying informed about what's trending in the ever-evolving landscape of Westchester and beyond. We are your hosts, Amanda DePalma, Senior Vice President of Events and Development, and Dr. Marsha Gordon, President and CEO of the Business Council of Westchester.
On today's episode, we're exploring the future of healthcare in Westchester, how world-class facilities, innovative leadership, and community-focused care are transforming the way healthcare is delivered across the county. Joining us are two outstanding healthcare leaders, Paul Dunphey, Senior Vice President and Chief Operating Officer, NewYork-Presbyterian Westchester, and President, NewYork-Presbyterian Hudson Valley Hospital, and Tara Ritchie, Vice President, the One Westchester Ambulatory Optimization. What's Trending is sponsored by Thompson & Bender and M&T Bank. Thank you for your support of the BCW Podcast Network.
At M&T Bank, we believe in making banking simple for our customers, like we did for Margarita, the CEO of Mas Panadas, a woman-owned empanada company.
M&T has taken a significant weight off her shoulders with their tools, their support. I don't want to be worried about banking and worrying about my finances just not running smoothly. And if there's any snag, that I can just grab the phone and call and get help.
See what banking together can do for you at mtb.com/together. Member FDIC.
Looking for unparalleled success in PR and marketing? Look no further than Thompson & Bender, the leader in strategic communications. With over 30 years of expertise, they've mastered everything from PR and advertising to social media and event marketing, ensuring their clients' success. Recognized with awards like the Business Council of Westchester Hall of Fame, City and State Power 100, and voted Best in Westchester for advertising, public relations, and social media by 914 Inc., their track record speaks for itself. Join the ranks of clients from Fortune 500 corporations, small businesses, educational and healthcare institutions, and many more who've benefited from their innovative strategies. Trust Thompson & Bender to elevate your brand to new heights.
Paul, let me start with you. We just had the privilege last month of having you at our annual dinner as a speaker. And your story is amazing. Your leadership is incredible. And we know you're especially proud of NYP, the One in White Plains, which just opened a few months ago, making NYP one of the largest healthcare employers in Westchester. Can you tell us a little bit about the One?
Sure. And Marsha, first of all, on behalf of Tara and I, we're just thrilled to be here with you today. And what a special night it was celebrating with you all. It's just BCW is just an amazing organization, and it was a real honor for me to be there.
And Paul, it's also an incredible honor to have you on our board. So thank you.
Thank you. So we could not be more excited about the One. The One opened up as planned on September 9th. But that date means a lot for all of us. But what's, I think, as important is it's just been a multi-year effort. A lot of work going on across NewYork-Presbyterian and with our partners at Columbia University and Columbia Doctors. It's been many hundreds of people working to get this building ready, as well as so many people from the community. The relationships and the connections that we formed have really been instrumental in our success. A little bit about the building. The address is 1111 Westchester Avenue. It's a really convenient location right off 287 and 684.
You cannot miss it. You cannot miss it.
I see it every day on my way home.
Well, love it. And on the way home, you can see the nice, bright lit New York Presbyterian sign to help guide you home. And the building is big. It's 340,000 square feet. It's 4 floors. We have a whole range of services, including operating rooms, an infusion center, physical and occupational therapy services, the most advanced imaging and radiology services you could have. And what we're really, really proud of is over 90 specialties and subspecialties for both adult and pediatric care in the building. And all of the care is provided by Columbia, top Columbia specialists.
I've been in the building. I had the privilege of attending the grand opening, and it is truly a beautiful building, and it's also welcoming, and you get the very best healthcare there. So it's very, very impressive.
I think that's one of the most important things, Marsha, the welcoming aspect.
Yes, absolutely. Absolutely.
Thanks for sharing. And part of what we've done is really, and we still have improvements to make, and we're learning a ton over the last 62 days since it's been open. But the culture that we've built with the teams in the building, we spent a lot of time on that opening up, and we're getting great feedback from our patients. There is something that we score. We have a customer evaluation system that we use, and about 97% of the patients that have come through have said that they would recommend this location to
Congratulations. Congratulations.
Now, Tara, I want to also take a moment to congratulate you on being named one of 914 Inc.'s Women in Business Award winners. Women's Health is one of the centers of excellence at the One. So can you tell us a little bit more about that, Tara?
Yes, thank you so much. And I'd like to first start by saying it is a true honor to be acknowledged amongst the other women at next week's award ceremony. I mean, they cover a wide variety of industries, but at the core, everyone is just really committed to Westchester County. And so just to be acknowledged amongst those women, it's just been a true honor and privilege. And for anyone who knows me professionally and personally, they know that I'm very much an advocate for women's health overall, even starting at a young age as a Girl Scout troop leader and a lifetime member of the Girl Scouts. I really, truly believe in women's health and advocacy. And so here at the one of our centers of excellence, Amelia Fazzolari has graciously supported the Integrated Women's Health Program at the One. And this takes care of all patients at all different ages. So it's adolescents, it's, when people are having babies, it's menopause and beyond. And what we've really focused on here is making sure that we have all the different services here on site so that the patient could be seen by their doctors. They can receive their annual exams for mammography, as an example, and other diagnostics that are needed. We also have private pelvic floor therapy rooms, and that's really important here in Westchester because you don't have many of those private rooms available. So those are key details that we were putting together when we were creating the clinical services and the offering here. And it's just overall a member of the community. And, being a resident here in Westchester, I knew that this was really important. All of the market data pointed to this. And so we're really fortunate that Amelia Fazzolari also saw this commitment and started really bringing these different clinical services to life here.
Well, I have to say that's really listening to your patients and delivering to them. So thank you for that. Paul, you were talking about earlier about how really you can see the red lights of New York-Presbyterian as you're traveling home on 287. How does this new building really enhance NYP's footprint in Westchester?
Yeah, so, as Tara was mentioning, we've really learned and been listening to a lot of the consumers, and consumers really want convenient access to care, ideally close to home. And in particular, the ability for us to provide access to Columbia doctors throughout Westchester is key for us. And so, we a little bit of a play on words, but while we celebrate the opening of New York-Presbyterian, the One, I think a key concept for us is One Westchester. And how do we bring a whole robust range of care across Westchester? So, we have outpatient locations ranging from Yonkers well on up to Cortlandt Manor. We have 3 inpatient hospitals now with New York-Presbyterian Westchester, formerly Lawrence Hospital, Hudson Valley Hospital, and New York-Presbyterian Westchester, which is a behavioral health center. And throughout those locations, we offer a broad range of clinical services. Again, all Columbia doctors, the inpatient behavioral health is affiliated with Cornell. So we really think that we can provide just a really strong range of clinical services for anyone's healthcare needs across Westchester.
So We also know that in today's environment, many aspects of the healthcare system can be complex and challenging, to say the least. Paul and Tara, as leaders of our world-class healthcare systems, can you share some of your priorities?
Sure. Tara, do you want to start?
Sure. We know that the people of Westchester are very excited to have our Columbia doctors providing the wonderful and exceptional care here at NewYork-Presbyterian, the One. And we've seen this just with the sheer volume of the patients and new patients to not only Columbia doctors, but overall to our system. As we were really figuring out the clinical programs to offer here, again, like you said, we really listened to the community and we identified those aspects in those areas that we knew that people wanted closer to home. And we know that when people go in to see healthcare, and specialists in particular, they not only want to see maybe their primary care physician, but if they get referred to, let's say, an endocrinologist or a diabetologist, they want that warm handoff. And that's something that we're offering here at the One. We have all of these different services available here. And one of our differentiated experiences is that when our patients are checking out, if they have a referral, we're making those introductions. We're either making those appointments for them or providing them ways in which to get access to that next step in care. So we're really looking at ourselves as healthcare partners for the people who are coming here to NewYork-Presbyterian, the One. And then as care gets escalated, of course, we have a wide system and breadth of the system where we can send our patients to our hospitals and within the system based on their care needs. It's really exciting, and Paul was saying this before, for all of your care needs, whether it's just your annual exam to check in to stay healthy, we can also see patients that also have higher levels of care or have more complex problems and issues where they normally have to go travel into the city to see Columbia doctors. They're able to do this in the convenience within the community. Easier commute, complimentary parking on site, a lot of wins for the people here in Westchester.
Those are great priorities. Thank you, Tara. Thank you. Paul, anything to add?
Yeah, I think that was terrific. And I may just come from a bit of a different angle. For us, partnering with the community is so key. And we know that there are many significant social and economic factors that are impacting health and the health and well-being of our community. And so as part of the care that we provide, it's also with partnering with other organizations in order for those community-based programs to really excel and thrive, that we know that they do way better than we can do. And so the last couple of years, we've been giving out about $2 million in grants each and every year to help these community-based organizations. Yeah, and a lot of work with adolescents in the area, whether it be summer youth programs or the Yonkers Partners in Education that trains a lot of school students.
We're big YPI fans, yes.
Yeah. So, and that is really special for all of us to make those partnerships and make those investments in the community.
We say here all the time at the Business Council that, just the power and strength of relationships are so important. And it sounds that's, the general theme and culture with NYP as well. So thank you so much for this so far. We're going to take a quick break. You're listening to the BCW Podcast Network. This is What's Trending, and we'll be right back. Looking for unparalleled success in PR and marketing? Look no further than Thompson & Bender, the leader in strategic communications. With over 30 years of expertise, they've mastered everything from PR and advertising to social media and event marketing, ensuring their clients' success. Recognized with awards like the Business Council of Westchester Hall of Fame, City and State Power 100, and voted Best in Westchester for advertising, public relations, and social media by 914 Inc., their track record speaks for itself. Join the ranks of clients from Fortune 500 corporations, small businesses, educational and healthcare institutions, and many more who've benefited from their innovative strategies. Trust Thompson & Bender to elevate your brand to new heights.
At M&T Bank, we're continuously working to provide value to our customers. like Lou, the CEO of OOFOS, a revolutionary footwear brand.
I think the thing I like most about working with M&T Bank is knowing they care. They sincerely care about us as a company. It's not just about the business transaction. They personally care about our business and our success and would make decisions that go above and beyond to achieve that.
See what banking together can do for you at mtb.com/together. Member FDIC.
Welcome back to the BCW Podcast Network. This is What's Trending. Paul, Tara, Amanda, and I have been having a fantastic conversation about NewYork-Presbyterian's impact and evolution in Westchester. So let's pick up where we left off. So much is happening in the world of healthcare at a record pace. What do you both see as some of the most exciting and impactful healthcare innovations that can be expected in the decade ahead?
I think there is such an explosion of technology and innovations, and a bit scary because I think we're learning each and every day of how to take advantage of that. But I think the critical piece is how it's enabling our caregivers to really make those special connections with patients, and how can we really provide better health for our patients. We're seeing that more and more in some of the work that we're doing, particularly in leveraging whether it be artificial intelligence to help with looking at a number of EKGs of patients coming through the emergency room, and really help interpreting should a patient see a cardiology as a follow-up, which is really, really neat. And also different innovations around the bedside. So tools that are helping nurses spend more time with patients, because we can have essentially a virtual nurse doing that remotely from a different location. So I think there's a lot that we're doing that is really, truly innovative. And Tara, I don't know if there's other pieces. There's so many that we can highlight here.
Sure. Thank you, Paul. I mean, as we see a shift in healthcare, we're seeing a lot more shift of just overall procedures to the ambulatory space. So patients who at one point were going into the hospital and staying for 10 days post-surgically, we're discharging them the same day. And so how do you then take care of those patients to make sure that they have good outcomes, good and quality outcomes? So at the One, we offer certain technologies such as the zero gravity machine in our physical therapy space. This helps patients load bear using a harness system so that they are eventually able to build their strength in their legs. And they're also able to use the zero gravity machine. So it'll help them start walking, not only just straight line, but also what if something comes in your path and you need to abruptly stop? It gives the patients the confidence as they're building that strength and as they're going through that physical therapy. For patients with vestibular issues, otherwise known as maybe just dizziness or imbalance, we have a Bertec machine, which is almost like an enormous virtual reality machine where the patients, again, are able to go in. We give different scenarios for the patients to see through this kind of virtual reality environment, and we're able to throw off their balance so that they can reprogram neurologically how they would address or deal with those issues coming their way. And then one of the other items that I think was really important as we were opening the One is we have a photon counting CT machine, and this offers amazing images into the body. We already have awesome technology from an imaging standpoint, but the photon counting CT is truly a step beyond what others are offering in and throughout Westchester. And we have already seen a lot of patient need and demand on those types of technologies. And as our population continues to grow here in Westchester, we know that those technologies will be tapped in even more so.
So just saying those innovations and those technologies are inspiring, but what can you both share that inspire the work that you do and sustains that momentum that you have as innovators and change makers?
Tara, do you want to start?
Sure. One of the items I just really want to highlight about the One, and we're really proud of this, Paul and I both advocated pretty hard for this because we are attached to an academic institution. Columbia is a destination where patients go to receive innovative and novel protocols and care that might not necessarily even be out to market. So in our infusion center, as an example, we offer clinical trials and research-based protocols in our infusion center. So patients no longer have to go into the city to receive those types of treatments. They can come here, and while they're getting their normal standard of care infusions, then maybe their next visit, they'll come for that research protocol, if you will. So imagine a day that we even would have said 5 years ago, we're going to bring all of these amazing options for you to sustain and have a great, healthy life closer to home. People are no longer having to trek into the city to get that kind of care. And that was really important for us as we were opening NewYork-Presbyterian, the One.
It's all so very exciting. It's thrilling to have you here. You're also a major employer here in Westchester, and we thank you for that. And throughout New York State. Thank you so much for joining us today on What's Trending. Your insights into healthcare innovation, community impact, and leadership have been truly inspiring. And we thank you so much, especially for taking care in every way of so many aspects of our community. Your presence means so much to us. Thank you so much.
Thank you both for being on the show today. Thank you again to our sponsors, Thompson & Bender and M&T Bank, and our listeners for tuning in. Be sure to rate, review, and subscribe. Be sure to check out the BCW Podcast Network's expansive lineup of shows: Leadership Unleashed, What's Trending, Advocacy and Politics Unplugged, The Member Spotlight, and Nonprofit Voices of Impact. The Business Council of Westchester is the county's largest business membership organization focusing on economic development and advocacy. With over 1,100 members, it is our mission to work for the profitability of our members and the prosperity of the Westchester community. To learn more, go to thebcw.org.